How many people understand the meaning of the word mind-body? How many people don't have a clue? How many people think it's an island in the Bahamas? During this lecture tonight, I will present psychological and scientific research showing the governing influence of the mind over the body. And after this lecture, I think you will understand the power of the mind over the body and how this is a missing element in traditional healthcare, yet can lead to transforming disease into health and healing. So, mind-body medicine is promoting health in the body as the best treatment for disease, using the natural pharmacy. I was at a cancer lecture 2 weeks ago where they talked about big pharma, P-H-A-R-M-A, the farmer market, P-H-A-R-M-A, versus the farmer's market, F-A-R-M-E-S. So this is using the natural tools for healing, promoting health, and then understanding the influence of the mind over the body. The focus is not so much on treating disease as it is on promoting health, and it rests upon the idea, the truth, that the best treatment for disease is the promotion of health. And it shifts responsibility back to the patient. It stands in contrast to the medical model, which basically says it's the doctor's responsibility to find out what's wrong with you, to give you a pill to make it go away. The medical model is what prevails in our society at the present time. It was birthed in the early 1930s when Sir Alexander Fleming discovered penicillin. And in so doing, he had a very effective treatment for the most common medical problems of the time, which were infectious diseases such as pneumonia. People were dying of pneumonia and influenza and meningitis and various types of infections. Penicillin changed all that, and that was the birth of the drug industry as well as the medical model. Again, it's the doctor's job to find out what's wrong with you and give you a pill to make it go away. This is the penicillin mold fungus, which is kind of the father of the drug industry. However, since 1930, the patterns of illness in our society have changed dramatically. We no longer have infectious diseases as the main medical problems. Instead, high blood pressure, heart disease, diabetes, cancer, arthritis, depression, digestive disorders, and a host of issues. We call them chronic illnesses. I realized quite some time ago that they're called chronic because drugs don't heal them. So they conveniently label them as chronic diseases. This is the epidemic. Chronic illness is the epidemic in our society. According to government research, this is the epidemic of chronic disease accounts for 70% of all deaths in this country. Heart disease, cancer, stroke, chronic lung disease, and diabetes account for 2/3 of all deaths each year in our society. 57% of Americans have one or more chronic illnesses, and as of 2007, 51% of American children and adults were taking one or more prescription drugs, which is an increase from 2 years prior. This is the true epidemic. It's also an expensive epidemic. The United States spends twice as much on health care per person than any other country. Twice as much. Number 2 spends half that amount. And it continues to increase. 75% of all healthcare dollars are spent on chronic diseases. It's a system designed to treat illness. From 2000 to 2006, inflation increased 3.5%, wages have increased 3.8%, and healthcare premiums increased 87%. Half of the bankruptcy filings in the United States are due to medical expenses in 2005. Are we getting our money's worth? U.S. ranks 47th in total life expectancy. We spend twice as much, and we rank 47th in industrial nations. We rank 43rd in infant mortality. So who's benefiting from the chronic disease epidemic? The drug industry is doing quite well. It's the most profitable business in America. In 2002, the drug industry made 14% return on assets, while the average Fortune 500 company made a median of 2.3%. It's a highly profitable industry, and they've used their profits to perpetuate a myth, which is drugs heal and the medical model works. Their budget for perpetuating that mythology is $25 billion a year. And the drug industry spends more than $5.5 billion annually to promote drugs to doctors, which is more than all U.S. medical schools combined in this country. There is no other industry that spends more money or has greater influence on government than the drug industry, buying influence. They're very effective. You know, it's not a conspiracy. They're not bad guys. They're just very good corporate businessmen. Does the medical model work? It doesn't work very well. This is the British Medical Journal, which is equivalent to the Journal of the American Medical Association in our country, and they reviewed, I think, about 2,500 medical treatments for clinical effectiveness, and only 13% are rated as beneficial. There are 2,500 treatments by other medical doctors. 23% likely to be beneficial. 46% are unknown. That's almost half. 10% are likely to be ineffective or unlikely to be helpful at all. The Clinical Practice Guidelines is the website that you can go to if you're a practitioner. I think anyone can go there, and you can see what the so-called standard of care. This is what you should be doing if you're a good doctor. You can look up any diagnosis like high cholesterol, high blood pressure, heart disease, and you can read what is the standard of care. Well, it turns out, according to an article in the Journal of the American Medical Association, that 81% of the authors for the Clinical Practice Guidelines have financial ties to the pharmaceutical industry. The solution to the chronic disease epidemic, according to government research, is that they're very preventable. We need lots of preventive measures. It turns out that the same treatment measures are the same things used to prevent. This word could be treatable using. Chronic disease requires a practice of medicine quite different than that used for acute disease. Most doctors, all doctors,